Thank you. Thank you. Good afternoon. Thank you for inviting me to come here to this fantastic conference and to participate in this very interesting session. So I think the two first speakers really highlight this topic from two very different angles. I really enjoyed the first speaker who's coming from the technology world. I am, as you heard, I am a clinician and a researcher, old age psychiatrist. Have been working with dementia research and clinic all my career. And I'm definitely a low-tech guy, so I'm constantly harassed by my kids. I use my iPhone, that's it, so I am not a high-tech guy at all. I was thrown into this area a couple of years ago when we were awarded this IMI project, Wider ID, which I will talk about later on, and also has a session tomorrow, which is about using digital devices to measure functional decline in Alzheimer's disease. And during that work, the preparation and the planning of the project, it struck me that whereas everything else has changed around me in these 25, 30 years I've been in the field, I still assess my Alzheimer's patients the same way. I ask the same questions about the cognition and also about the function. And I certainly realized there is a lot to gain from utilizing novel technologies. So I think I'm probably in a honeymoon phase and probably in a risk for being in going into the temptations we heard about. But I think it's a unique opportunity. And I will talk from the perspective of clinical assessment and mainly from a trialist perspective. So you know, we have, despite the good news 2 days ago, we have a number of negative trials for new medications for Alzheimer's disease. And why is that? Well, probably many of the drugs they don't work. However, it's also a case that our ways of measuring response are very old-fashioned and crude and have been done the same way for many, many years. And I think utilizing novel technologies will absolutely increase our chances to detect effects of medications and other treatments which are really there in a much better way than we have had until now. So the plan is then to, I will go through the available technologies that can be used for measuring a variety of symptoms, which opportunities and challenges the digital devices represent. I'll talk about not only about the wearables, but digital technology or digital biomarkers in general, and also some examples of specific studies that have been published showing that we are emerging good measurements of cognition and other symptoms in elderly people using these devices, and if time allows, a little bit about the Radar ID project, although, as I mentioned, that will also be covered tomorrow. So what about, is it possible to get this monitor a little bit closer? Is that what we have? Oh, we need glasses, yes. First of all, what is the problem? Why do we need these new devices? Well, as I mentioned, the standard use for clinical assessment and trials is to use clinical assessments and to use conventional biomarkers. And although they are improving and we are getting better, they have lots of limitations. So we usually see our patients infrequently. It's a big challenge, and it's costly to have the patients coming to the clinic more often. It's costly to have staff seeing the patients. Self-report is inaccurate, and also there's a variation in the. Oh, yeah, perfect. Thank you. Thank you. So this is a talk about technical devices. So it was a very good start. You can't hear me. I can't see what I'm going to say. So this is going well. Well, clinical assessments have their strengths, but they also have their limitations. So we have retrospective bias. We ask people, how have you performed, for example, in functional activities during the last 3 to 6 months? It's difficult to give a very good, accurate, and measurable answer to that. And then we have the conventional biomarkers that we use in clinic. We can use imaging, and we use cerebrospinal fluid markers. They are very helpful and can monitor disease progression, but they're also expensive and they're invasive, potentially risky. There's limited access to these. So there are several challenges that we then are faced with, and where biomarkers, digital devices can help us. So the wearable and other digital devices can objectively measure functions. They can be quantitatively assessed. They can be used repeatedly or even continuously over a period of time. Many of them are unobtrusively, just a sensor or a wearable on the body of the person, passive and hassle-free. And we are now also achieving opportunities to really measure big data and analyze them in a sensible way. These devices provide huge volumes of data which are challenging to analyze and handle, and they're also very promising developments enabling us to do so in a good way. So this means that the digital biomarkers can help us in clinical practice, improving diagnosis, monitoring disease progress, and detecting acute worsening of the situation. And also in research can help us identifying the cases, the patients, the participants we want to include, and also have very sensitive measurements of change, relevant changes that we want to influence using medicines or non-pharmacological interventions. So that will mean that we can have more efficient trials. We can save a lot of money, have more cost-efficient trials because we have more sensitive outcomes. We can reduce the sample size, and that's a clear societal benefit. So there are potentials here that we face. But on the other hand, there are huge challenges. We've heard some of them discussed, so this is by no means an easy way forward. So there are many ethical challenges, many of these related to data protection, privacy of data. We have a number of regulatory aspects which have to be solved. We have issues with feasibility and acceptability with the participants, the patients who are to wear these wearables, whether they accept it or not. And as I mentioned, there are challenges in terms of data analysis, data processing, data modeling, etc. So there are huge challenges which have to be solved. They are being solved. I think there's a lot of progress in the years I have been in the field and the literature I've read. So there's a lot going on. And as you will see, unlike when I usually present, all my citation will be from the last 1 or 2 years. So it's a huge activity as we speak in this area, which is also promising. So a number of clinical symptoms can be addressed by remote monitoring devices or digital wearables, biomarkers, etc. Cognition, of course, cognitive fluctuations, that's common in some diseases. Functional decline can be measured. Psychiatric symptoms like mood, anxiety, behavioral changes, agitation, even aggression, apathy, withdrawal, and in particular motor symptoms such as gait and other motor symptoms, shaking, tremors, reduced speed, etc., and balance. I want to mention that in the field of Parkinson's disease, where I also work, part of my research, they've come a long distance in terms of using wearables. Obviously, that makes a lot of sense. They have tremors and motor symptoms which are fairly easy to measure using devices. But then we also have other physiological symptoms like cardiovascular and autonomic symptoms. Sleep is a very good example of behavior or symptoms that can be measured with devices, and EEG potentially, and social activity, etc. So there are a number of relevant behaviorals that can be addressed using devices. This is one very recent review listing the digital biomarkers studies for MCI and Alzheimer's disease. And you can see most of the studies used smart home or smart car technologies. We heard about sensors, so that using sensors in the home or in the car. 6 studies had used dedicated wearable sensors, accelerometers, GPS, etc., measuring movement speed, etc. And then we have active, dedicated technological solutions. People then asked to do specific tasks on their mobile phones or iPads, games, online surveys, etc. And then we have a tradition using data, computers, iPads, phones, and taking information from that use and derive relevant cognitive and functional aspects from that type of behavior. So that's kind of that's where the literature has been up to now. Now I want to move a little bit into specific studies. And one group in Oregon with Jeffrey Kay and colleagues have been in the forefront of this development. And here are 3 of their many published studies. They looked into computer use, mouse movements, and online survey metadata, the use of computers. Can that tell us something about function? And this is a study showing that the number of days using the computer in people with MCI, the red ones, declined during follow-up compared to elderly people who had normal cognition. So just the mere use of computers was an indicator of something going on related to cognition in these patients. And then they used a variety of measures related to the use of the mouse when they use computer. And this chart shows that there is an association between cognition on the Y scale and time to make a mouse movement. So that there's an association between the use of the speed and time to use a mouse and the cognitive function. This is across healthy people and impaired people. So this study, they concluded that people with MCA had fewer mouse moves and larger and more variable number of more curved or looped mouse movements. Apparently these are indicators of not efficient use of the mouse. And so that is one let's say, modern measure of instrumental activities of daily living, the use of computer and mouse, which is less efficient and subtle and probably impossible to detect by use of standard instruments. And then in addition, they measured whether participants followed advices in terms of submitting online surveys as part of the study, and we can see that people with MCI did less frequent complete the surveys, and they did it later on the day and spent longer time. So the increased time was 3 seconds per survey per month. So you can wonder whether that is clinically meaningful, but it is still a way of ensuring that we can tap into some hidden behavior which is relevant for Alzheimer's disease. Another method of assessing function using devices is to look into driving, and there are several sensors available that can be put into the car, and this is a study again from the Oregon group. So you can see people with and without MCI, and they studied driving for 6 months. People with normal cognition had greater variability in daily driving distance, and they drove more miles and spent more time driving than people who had MCI. However, a little bit surprisingly, in more qualitative measures of driving, such as a number of hard turns or hard brakes or driving too fast, did not differ between the groups. So interestingly, you would think this is something people would maybe not get into, but 80% said that they would absolutely like to complete more similar driving studies. So this is acceptable for participants. This is one just example how, again, this group, we talked about putting sensors everywhere and multimodal sensors. This is one way to show how they have developed a system in Oregon, a number of different physical and home-based sensor driving devices, computer devices are linked together into a secure internet platform and then analyzed. Obviously, this is not something, this is not to improve quality of life, but this is to potentially measure relevant behavioral changes, which show this as an example, not going into data. Another similar project, very ambitious, where the commercial partners are joining Apple, as you can see, Apple and Eli Lilly and Agitation Health. Also a multi-domain project, only wearables, looking at 12-week duration of people with normal cognition and people diagnosed with MCI. Platform of consumer-grade, normal instruments, iPhones, iPads, that were then combined to measure a number of potentially relevant functional changes. So skip that. So you can see here they could look into motor function, they could look into autonomic function, circadian rhythms, behavioral, social, and cognitive behaviors, and fine motor control and language by using the Apple Watch, the iPhone, or the iPad. And you can see they stipulated specific hypotheses how people with MCI would potentially change on these behaviors using these devices. This is more like a feasibility study, not an efficacy study. So to check whether this system can work, can actually separate between people with normal versus impaired cognition. And in fact, they were quite accurate in the prediction of MCI versus normal cognition. And the features that particularly separated the groups were that people with MCI had slower typing on the computer keyboard. They had less regular use of their phones, the first or last phone call. They started moving, the first step, later during the day. They received fewer text messages. They had greater reliance on helper apps like Siri and clock apps, and also had lower compliance in terms of the active surveys that they were supposed to do. So they were able to separate between the two groups using this platform. 1 minute to conclude. Then I will use that minute to talk about another symptom, which is agitation. A recent review there, published last year. Agitation, as you know, a very important symptom in more advanced dementia. And here, I found that studies had used actigraphy, some had used cameras or multimodal sensors to detect agitation and measure and quantify it. Again, agitation also a challenging symptom to measure accurately, particularly what's going on during the nights. And they conclude that it is promising, but that more studies are needed in terms of validation, user acceptance, and also big data analysis. And one of the a more recent study afterwards supported this, finding an association between the Cohen-Mansfield agitation score and the amount of movements using the actigraphy. So that's where we are. Radar will be presented tomorrow in session 29, so we will skip that and just sum up. So a variety of biomarkers are available and potentially useful for a variety of different clinical assessment and can be used for trials in the future, hopefully. Many different symptoms are accessible for digital devices. So many studies, they are yet small and with selected sample size, a short duration, and the feasibility is questioned. But they are usually well accepted, and good compliance reported on the studies that have been published, and the preliminary findings are promising for future use. But in general, the focus, the outcomes are fairly crude. For example, duration of mobile use, speed of walking, etc. So I think there's a potential for more fine-grained analysis. And finally, future studies need also, in addition to more fine-grained output, also need to have a longitudinal design and use larger samples. And with that, I want to thank you and thank my collaborators on the radar ideas. Some of them are listed here. Thank you.